An ankle block provides complete anesthesia to the foot by targeting 5 distinct knobs, 3 superficial and 2 deep knobs. We start with precise surface marking. Firstly, we identify our major bony landmarks. I'll mark the prominence of lateral malleolus followed by medial malleolus. Next, we ask the patient to actively dorsiflex the great toe. This makes the extensor hallucis longus tendon prominent, and then we'll mark its tract clearly. To keep our injections uniform, we draw a circular band 2 cm above the level of malleoli. This line acts as our structural guide for circumferential infiltration. Right here, just lateral to our EHL tendon mark, sits the deep peroneal knob. Spanning between extensor hallucis longus and the lateral malleolus is the broad network of superficial peroneal knob. Moving posteriorly in the gutter between Achilles tendon and lateral malleolus, we mark the course of Sural knob. Turning the ankle slightly to expose the medial side, we found Saphenous knob, which is running in the space between medial malleolus and EHL tendon. Finally, behind the medial malleolus, we palpate the posterior tibial artery pulse. Just posterior to this artery lies our final target, the tibial knob. For this block, we are using 2% plain lignocaine. Avoid adrenaline here to prevent vasoconstriction to the terminal digits. We begin our block at our initial mark just lateral to the EHL tendon, targeting deep peroneal knob. Insert the needle perpendicular to the skin, straight to the bone. Withdraw few millimeter, aspirate as we are not intravascular, and inject 5 ml of local anesthetic. Without withdrawing the needle completely out of the skin, pull back into the subcutaneous space and redirect it medially towards the medial malleolus. Here we inject 3 ml to create a superficial wheel for Saphenous knob. Since the standard needle length won't breach the entire distance, completely withdraw the needle and re-enter through the edge of the skin which we just anesthetized. This keeps the procedure virtually painless for the patient. Now again, return to our original entry point lateral to EHL. This time, angle the needle laterally towards the lateral malleolus, creating another subcutaneous wheel to completely blanket this superficial peroneal knob. Continuing posteriorly, we infiltrate the subcutaneous space between the Achilles tendon and lateral malleolus to block the Sural knob. And then we finish with the largest knob, the tibial knob. Position your needle just posterior to the posterior tibial artery. Advance deeply until you make contact with the bone. Withdraw a few millimeter. Always aspirate and slowly deliver 5 ml of local anesthetics. Allow 10 to 15 minutes for the block to fully set, and you will have complete anesthesia of the foot ready for surgical intervention. Thank you for watching, and do subscribe for similar surgical videos.